The pathology comes back and we find prostate cancer. And this is the challenge. The challenge is what kind of cancer is this? And let's go into detail over this because it's one of the most important things that we look at, certainly on the early stages of prostate cancer. Prostate cancer is graded, and the way that we grade prostate cancer is what's called the Gleason Grading System. And the Gleason Grading System actually goes from a scale of 1 through 5, 1 being the least aggressive, 5 meaning the most aggressive. But it's an additive score, meaning that you actually have two numbers together. So you have 1 through 5 plus 1 through 5. So before we go into details over that, let's talk about why it's an additive score. Prostate cancer is not just one solid and sole entity as a whole in the prostate. You can have multitude of areas. So it's a multifocal disease as a whole. Yes, you can find one small area or one even larger area of just that solitary focus of prostate cancer, but as a whole, we're finding several different areas, and they're not all the same grade of cancer. So when we do that biopsy, that pathologist will then look at that prostate and look at that cancer and say, this is a specific grade. And again, whether that's a Gleason 3 or whether that's a Gleason 4. And then again, we come up with that score. So you have those two numbers together. Okay, so let's talk about that. So if they see, and we'll make it simple. If the only score that they see, or the only grade that they see is a 3, by default, that Gleason score is a 3 plus 3. Again, 3 plus 3 equals 6. So that's a Gleason score of 6. Pretty easy. All we see is a Gleason grade of 3, and by default, it's a 3 plus 3. But if we have a Gleason 4 in there, then the question is that of that biopsy that you took and it comes back, the pathologist will then let us know of that specific specimen. So again, think about that small little specimen, again, that little toothpick specimen that went over the pathologist. That pathologist will then let us know there is a Gleason grade of 4 in there. If a majority of that small little specimen is a 4, your Gleason score is going to be a 4, but you've got a little bit of 3, it's a 4 plus 3, and that's a Gleason score of 7. If a majority of that specimen is a 3, but you have a little bit of 4, then that score is a 3 plus 4. And that does make a difference because we know that as a whole, the higher grades, when the 4 comes first, then those cancer specimens actually do have a tendency to grow faster if they've got more of a 4 in there than less of a 4. So a Gleason 7, 4 plus 3 tends to grow and tends to react just slightly differently than a 3 plus 4. Okay, so now we got it. So now we know how to use those scores. So we have a Gleason score of a Gleason grade and a Gleason score. The score involves two numbers. The grade actually involves just one number. Now I'm going to make it a little bit more confusing. As you started out originally, we said it was a Gleason, you get a score from, or grade of 1 through 5. You know, what we found is that we rarely, if ever, see 1s or 2s anymore. So to really throw the monkey wrench in here, we really start at 3s. Yes, you can see 1s or 2s occasionally, but it's very rarely ever seen now. So primarily we have 3 through 5 plus 3 through 5. Again, can you see the 1s or 2s? Very, very rarely, but for all intents and purposes, it's a 3 through 5 plus 3 through 5. Got it? Okay, here's what we've got. So now we talk about the scores. So when men talk about their Gleason score, routinely they're talking about a 6. I've got a Gleason score of 6. Some people see a Gleason grade of 6. That's not technically correct because their grade is a grade 3. Their score is a score of 6. But that being said, everybody knows what they're talking about, all right? So you've got a Gleason score of 6, and what we describe as a 6 is routinely a lower grade prostate cancer. If you've got a Gleason score of 7, whether that's a 3 plus 4 or 4 plus 3, that's what we describe as an intermediate grade of cancer because you've got some 3s in there, you've also got some 4s in there. Whether it's a 4 plus 3 or 3 plus 4, routinely that's, for all intents and purposes, an intermediate grade. So now we start working to the higher grade cancers. The higher grade cancers are 8, 9s, or 10s. You could potentially have a 3 plus 5, and a 3 plus 5, do the numbers, it adds up to 8. So again, 8, 9s, or 10s are what we describe as the higher grade cancers. These are the cancers that routinely do grow faster, they have a higher tendency to get outside of the prostate, and they do have a higher tendency to actually recur with whatever therapy we do on those patients. So it's important to know, are you in a low grade or a low score? Do you have an intermediate score or do you have a higher score? Okay, again, grade scores, however you want to call this thing, but you've either got a 6, 7, or an 8, 9, or a 10. That is the number one thing that we look at right when a patient comes back and we look at that pathology.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is, so most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.